The fight against COVID-19 is shifting gears. The healthcare system, which has already shouldered an epic load during this pandemic, will be taking over the vaccination effort that the state is now winding down at its fixed sites. Today, we'll get to learn more about how that will work and what's ahead in healthcare from John Jurczyk, president of St. Joseph Hospital in Nashua, and Dr. Michael Gilbert, chief medical officer at Catholic Medical Center. Thank you both for joining us. And let's start with you, Mr. Jurczyk. Give us a sense of the current footing of your hospital. In what ways are you seeing the ebb of this pandemic as vaccination begins to box in more of the virus?
Well, all of our services are open and full capacity. We're a pretty sizable demand. Certain services like procedures, endoscopies, imaging, and for the most part, it is, with the exception of some of the precautions like masking, temperature checking, we really are back to normal operation for the most part.
And Dr. Gilbert, what's the change been like at CMC? At one point, I think you guys had 50 plus people in the ICU with COVID.
Absolutely. At our high water mark, we had 50 people in the hospital with COVID. And just the other day, we had the first time where we had no COVID patients in the hospital in many months. And just like at St. Joe's, CMC is back to normal operations and busier than ever.
Mr. Jurczyk, you know, obviously things are shifting back to this kind of new normal. The volume of it has decreased considerably, but the hospitals have still taken a major hit over this last year. Can you give us a sense, not just for you, but the financial landscape for all hospitals in being able to recover from this?
So I think that, you know, for the most part, we're seeing some areas that has not returned. And we're having to think about, you know, creative ways of staffing, services that really have to make up that gap in terms of our financial performance. But overall, you know, we are, you know, we're very different from where we were this time a year ago, where we were losing on average about $2 million a month. Excuse me, $2 million a week. Sorry, but very different now. It is back in most areas.
And do you think there's going to need to be more government help, Mr. Jurczyk, at some point, you know, to try and continue to prop things up?
I think certainly, you know, that is a conversation that we have with our legislative group. You know, I think that we're not out of the woods yet. As I mentioned, demand is not back to normal for some areas, and certainly going forward, we probably will be looking at some form of support for our hospitals.
And Dr. Gilbert, getting back to you, what's the expectation for this summer? We know that the state epidemiologist has said we do expect to see numbers bottom out quite a bit, but what's it going to be like at the hospital? You mentioned you're hitting this, you know, patient zero kind of situation where there's nobody there. What's the summer outlook for you guys?
Absolutely. You know, everyone's looking forward to the summer. Last summer, after the first surge, we had a similar presentation where the numbers of COVID patients in the hospital went very low during the summer. We expect the same this year, even better, especially considering the success of the vaccination program that's been ongoing. We're trying very hard to take care of all of the sick patients in the community, especially some that had honestly delayed getting their care due to concerns of COVID. And then we're doing everything that we can to be ready for next fall. You know, expecting that there may be some level of resurgence as well as the flu season next fall.
And Dr. Gilbert, you know, so many people in healthcare have been vaccinated. So what kind of precautions are still in place for people who come into the hospital and still might be wary or things like that?
Absolutely. So we have an infection prevention team that really works very collaboratively with everyone in the state to make sure that we're offering the appropriate level of protection for staff and employees and patients while in the hospital. And we meet every 2 weeks and make recommendations based on things like PPE and masking and social distancing within the hospital. We obviously realize that we're going to have COVID patients in the hospital, so we have to do everything we can to keep patients and staff safe with the PPE as well as the testing. But we really try to flex those recommendations based on the severity of the cases within the community.
Mr. Jurczyk, take us through the workforce situation right now for hospitals. We know pre-pandemic there was obviously the need for nurses and shortages there. But into the pandemic, you had a situation where entire swaths of floors and staffs would have to, sit out for quarantine and things like that. And thankfully, that's not as much of a problem now. But getting back to our, quote unquote, new normal, is there still a workforce issue moving forward?
Well, there most definitely is. Workforce is a real strategic issue for many hospitals and healthcare systems. We are certainly competing on the entry-level positions with all the other industries that have workforce challenges. And, while we are not having challenges in terms of staffing to keep our patients safe, it is an issue long-term because of the aging of the workforce, the need to start a lot of workforce development programs in the area. So it is strategic. There is still an issue, and the pandemic has really kind of pointed its finger towards certain areas of the workforce that we have to focus on in terms of recruitment and retention.
And Dr. Gilbert, so many things have changed about how we operate as a society, and clearly for you guys in the extreme. What are some of the things that have changed at the hospital and are not changing back?
I'd say that one of the things that we would likely expect with future flu seasons is that we would see continued masking. We found that we actually had almost zero flu patients this past year because of increased in vaccinations as well as the masking and the PPE use. So I expect that's something that we would see in the future as well. The other thing is that we're always just going to be ready to pivot. We're always going to be expecting to have some type of a respiratory syndrome throughout the year. And we're really just trying to work in parallel with COVID or whatever the next viral syndrome is, and just finding ways to work in parallel with using the masking, with using vaccination, social distancing, so that we can continue to take care of all of the sick patients in parallel at the same time.
How about for you, Mr. Jurczyk, there at St. Joseph's? What's changing and you think staying that way post-pandemic?
Well, I would agree with all the points that Dr. Gilbert made. Masking is key. We really got to educate the remaining percentage of the general public of the importance of vaccination, its role not only keeping one's personal health in check, but also our coworkers and our community. So I think that's really key. The return of masking, we're still required in hospitals and healthcare facilities by the federal government to have masking in place. I don't see that going away, and certainly the case that Dr. Gilbert pointed out about the lack of flu, all those steps we took to prevent COVID, we should be putting in and implementing those steps for influenza prevention and going through the season.
I think in entire strains I've read that flu have disappeared so far. They might pop back up. Very interesting on that front. Just as we wrap up here, Dr. Gilbert, what's your number one concern moving forward? Even though things look great, there's a lot of optimism. What are you worried about for the future?
So one of the things that I'd really like to address is the burnout that our staff have suffered going through the past 14 months. We are having challenges, as mentioned, with staffing, particularly nursing shortages, which is a challenge. And then I'd say the next biggest issue that I want to make sure that we're all addressing is how we really continue to care for our communities. A lot of our communities suffered tremendously during COVID, and a lot of issues like mental health and substance abuse disorder really got worse during the pandemic because of despair. And so we really need to make sure that we're doing everything that we can to continue to care for our communities as best as possible.
What about you, Mr. Jurczyk? That number one concern moving forward?
Yeah, I think, we've only begun to see the impact of the pandemic on the mental health of the community. Opened at the end of the year a senior behavioral health unit, which was really focused on the senior population and their mental health due to the isolation that many seniors felt during the pandemic. And I think we're only at the tip of the iceberg in terms of the mental health crisis that faces this country.
All right, John Jurczyk from St. Joseph's Hospital and Dr. Michael Gilbert from CMC, we appreciate your time and all the work you've done for the people of New Hampshire over the last year.